Welcome to a deep dive into one of the most intriguing political health movements of our time. Robert F. Kennedy Jr.'s Make America Healthy Again, or MAHA, will uncover lesser-known facts and the potential game-changing impacts of this initiative.
All of the policies that we're talking about and thinking about are all about restoring democracy and restoring choice, informed choice to the American public, and doing that by decorrupting the agencies and actually giving good science so Americans and doctors have access to it, and then allowing them to make individual choices that the government will then support.
And let's dive into how RFK Jr. plans to revolutionize American health. Before diving into the policies, let's touch on something many might not know. RFK Jr.'s background in environmental law. His legal battles against corporations for polluting our rivers and challenging mercury in vaccines have shaped his unique perspective on health. His advocacy isn't new. It's been decades in the making, focusing on how environmental toxins affect our health. This foundation is crucial to understanding why MAHA isn't just about diet, but encompasses a broader fight against environmental health hazards.
A lot of people don't know that I spent 40 years of my career as an environmental lawyer. I brought hundreds of cases against companies like Mobil and Exxon and Chevron and Texaco to restore the Hudson River. Today, the Hudson River is an international model for ecosystem protection. I sued DuPont, Mitsubishi, and Ford to force them to clean up chemical spills. I sued Monsanto on behalf of farm workers and home gardeners and families who developed cancer from using their pesticides. And I battled all kinds of government agencies and giant corporations. I've fought and won victories for family farmers in our heartland, for mountain communities in rural West Virginia, for inner city neighborhoods in New York City. And the organization that I co-founded, Waterkeeper Alliance, has become the largest water protection organization in the world, protecting 2.7 million miles of waterways all over the planet.
RFK Jr. has spotlighted an issue often whispered about, but seldom addressed head-on: the chronic disease epidemic. Did you know that 6 out of 10 Americans suffer from a chronic condition? MAHA aims to tackle this by not just treating but preventing these diseases through diet, lifestyle, and environmental changes. His plan includes promoting real food over processed, advocating for the removal of pesticides linked to health issues, and even rethinking our approach to mental health through nutrition. Here's something you might not have considered: the role of RFK Jr. initiative in food safety. He's pushing for the elimination of up to 50 food additives currently legal in the US, but banned elsewhere due to health concerns. Ingredients like titanium dioxide, used in everything from candy to toothpaste, are on his hit list. This isn't just about cutting sugar or salt. It's about questioning what we've normalized in our food supply.
More and more Americans began suffering from chronic diseases, from obesity, cancer, diabetes, kidney disease, Alzheimer's, heart disease, and all kinds of autoimmune diseases. Our maternal mortality rate soared to the highest of any developed country on earth. Same with infant mortality. But now, in 2024, we're finally waking up to this cataclysm, and we're asking ourselves, how in the world did this happen? Well, a big part of it is our diet. It's the government that approves the poisons in our food. A few people get very rich, and the toxins end up in every supermarket aisle.
While much focus is on food policy, RFK Jr. quietly champions regenerative agriculture. This aspect of MAHA could change how we farm, aiming for practices that regenerate rather than deplete our soil, enhance biodiversity, and potentially reduce the need for chemical interventions.
I've seen some of what America's most innovative regenerative farmers are doing today. They can literally green deserts. They rebuild depleted soils. Wells that had been dry for 30 years start flowing again. They heal the land, and some of them make a very good living doing it. But unfortunately, many more have to fight the system in order to do what's right. It doesn't have to be this way.
If implemented, this could mean fresher, more nutritious food in our markets, potentially reducing the prevalence of diseases linked to poor diet. Beyond health improvements, RFK Jr.'s vision ties directly into one of America's most pressing issues: rising healthcare costs. Chronic diseases like diabetes, heart disease, and obesity account for over 75% of healthcare spending. MAHA isn't just about individual wellness. It's about addressing the systemic costs of ignoring prevention. By promoting healthier lifestyles and better nutrition, his initiative could save billions annually and make healthcare more affordable for everyone. Technology is playing a transformative role in health, and RFK Jr. wants to harness its potential. From wearable health trackers that encourage active lifestyles to apps that educate users on nutrition and toxins in their environment. Technology can empower individuals to take control of their health. Imagine a future where your phone alerts you to unsafe food additives or suggests local regenerative farms near you. These innovations align with MAHA's mission to bring health awareness to the forefront of everyday life. Perhaps one of the most under-discussed aspects is his plan for health agency reform. RFK Jr. has proposed not just cleaning house in terms of personnel, but also restructuring how these agencies function.
When it comes to MAHA, we talked about three things. Cleaning up corruption, what can we do? The FDA is 75% funded by pharma. The USD nutrition guidelines, which set guidelines for our children, 19 out of the 20 advisors are funded by food or pharma companies. The NIH is an orgy of corruption, where 88,000 grants in recent years have gone to conflicted researchers.
He's talked about focusing NIH funding on disease prevention, particularly through diet and lifestyle research, which could shift billions from pharmaceutical-centric research to holistic health studies. Imagine if the next big health breakthrough isn't a drug, but a dietary change or lifestyle adjustment. RFK Jr. Make America Healthy Again movement is more than just headlines about vaccines or political drama. It's a comprehensive vision for health reform that could change the fabric of American health policy. Whether you support or critique his methods, the depth and breadth of his initiative are undeniable. We've only scratched the surface here, but it's clear that MAHA aims to leave a lasting impact on how we view and manage health in this country.